Welcome, Greek U Nation, to episode number 324 of the Fraternity Foodie Podcast. I'm your host, Mike Ayalon, CEO of Greek University. I'm a speaker and a two-time author. Our second book is called From Letters to Leaders, Redefining New Member Education and Leveraging Belonging to Eliminate Hazing. So go and pick up that book today on Amazon. We call these episodes the Fraternity Foodie Podcast because there is nothing like great food to bring college students together. Fun fact, I love talking to physicians on our show because I feel like so many of us have neglected our bodies during the pandemic, and getting those normal checkups, maybe that's not happening. The maintenance and all the physical fitness routines that maybe we had prior to COVID-19 many times don't exist today. So our next guest is going to talk to us about health adversities and ways that we can persevere following COVID-19. Dr. Robin Hall is a board-certified family physician, an entrepreneur, author, speaker, and a cancer survivor. With over 30 years of experience in medical practice, Dr. Hall is well known as a trailblazer, an excellent diagnostician, and a medical educator. She has won many top doc awards in the Dallas-Fort Worth area and has been listed in Texas Monthly many years in a row as a Texas super doctor. Her personal and professional experience makes her uniquely qualified to help others gain an understanding of optimal medical care and what it is like to persevere through life's challenges. Welcome to the show, Dr. Robin Hall.
Thank you. I've been looking forward to our chat.
Yeah, this is going to be a lot of fun, and you have some great information to share with college students. So I am so excited about this interview. Let's go all the way back. Let's talk about Texas Wesleyan, which you chose for your undergraduate experience. Tell our audience, why was Texas Wesleyan your choice?
Well, it's called an academic scholarship, and it's hard to turn that down. Texas Wesleyan is a wonderful private liberal arts university in Fort Worth, and it has a good reputation, and I have family members that have gone there. So when I had that offer, you don't turn that down, and I'm so happy that that was the situation because it's such a great school, and because it's small, you have a lot of individual attention. And so that's the answer to that question.
I think that's great advice. My son is trying to figure out which college he wants to go to, and he's got a free ride to a college that's local. And I'm like, I mean, that's very attractive. Instead of being in debt and living in the basement for the next 4 years, maybe, you'll have no debt and you can just go straight into your new home or whatever it is.
Exactly, because medical school was a lot different. I had to pay for that. So it was nice not to have to pay for the undergraduate.
Absolutely. I agree completely. Now, you're a board certified family physician. You've got over 30 years of experience. What makes you so successful over such a long period of time there in Dallas?
Well, I think it's because I'm known for my compassion and true caring. I really have always treated my patients the way I want to be treated. And I've been on the other side of the stethoscope, which I like to call it. And so I just think that every individual deserves all of my attention. I'm a good listener. I'm very detail oriented and very thorough, and that's why I'm described as being an excellent diagnostician. So I really think that compassion is number one, and all of those other things have combined with that. The top docs, the super docs that Texas Monthly has, that's voted on by the peers. And so that's a real honor to have other doctors in Texas vote for me that many years in a row.
That's fantastic. I mean, all too often, it just seems like with all the paperwork that needs to be filled out for insurance companies and everything else, we lose sight of the patient and the oath that we've taken to the profession about being patient-centric. And, you get involved in all of these other things that pull you away from the patient, like paperwork and other nonsense. But at the end of the day, it's the patient. It's the patient that is most important. And I love that you have that bedside manner, that you're able to talk to patients like human beings, and really just, have empathy for what it is that they're going through at this moment. And I just think that in itself is a lost art. So good for you. I think that's amazing. Now, I do want to talk to you about sexually transmitted infections because students are going to be going off to school again in January for the spring semester. So I like to talk about this topic at the beginning of each semester. I think it's time to talk about some of the common sexually transmitted infections, some myths, some misconceptions, and how, most importantly, how can students be safe?
I'm really glad we're talking about this. College students are one of my favorite demographic to take care of because I feel like they are young enough that I can really make a difference with giving them some education. So everything you read on the internet is not true. Surprise, surprise. So I really like to talk to them about it in my office and have this opportunity. One of the things that people don't realize is there's over 25 different sexually transmitted infections, and they can occur with vaginal, anal, or oral sex. And I've heard college students tell me, oh, I didn't know it could happen with oral sex. They think they're being safe that way, but that's not true. Some of them only have some mild symptoms, and so they may not even know that they are infected, and then they pass it on to someone else. The most common ones that we see are gonorrhea, chlamydia, herpes, and HPV. And HPV stands for human papillomavirus. That one is the most common, and it's harder to detect, especially in men. And I'll talk about that one in a few minutes. But if we talk about those four individually, the ones that are the most common, gonorrhea and chlamydia, they're bacteria, and we can treat those with antibiotics. And so I think a lot of times students think, well, it's no big deal. If I get it, I'll take the antibiotics and I'll be fine. But actually, damage has already been done to the fallopian tubes in the woman, even though we can cure the infection. The inflammation in the fallopian tubes can decrease their likelihood of getting pregnant, or they can have a tubal pregnancy, or they can develop what's called pelvic inflammatory disease, which is a very uncomfortable uterine infection. And so those are the bacteria. Then you've got herpes. That's a virus. We can't cure that one. We can only treat it. We can give medication to suppress the number of outbreaks they have. But one misconception I hear about that all the time is people don't think that they can spread it if they don't have a lesion that they can see. But that's not true. That virus can be transmitted even when you don't see an active lesion. And that's probably one of the things that I see the most often is people say, well, he told me it was fine, or I didn't see anything. And then, they end up with an outbreak. Then HPV, and also back to herpes, that can be on the lips. It can be in the genital area. It can be passed through oral sex, vaginal sex, all the same things we talked about before. And then HPV, I mentioned that's the most common. There are many different DNA types of HPV, and some of the types are the ones that can increase the risk for cervical cancer in women, penile cancer in men, or oral cancer. And we're seeing more and more of that, like at the base of the tongue, for instance. And that's through, more oral sex. There are vaccines for HPV, and hopefully all of your listeners have already had their vaccine. But the vaccines don't cover every single DNA type. And that's something that I've seen in the practice. I warn people that you can still get HPV because the vaccine doesn't cover every type. And lo and behold, they come back after a semester and they have HPV. And it's just so disheartening to me to see that, because I try everything I can do to educate so that doesn't happen. And, it's very psychologically upsetting to develop an STI, especially with herpes or HPV, because if it's in a female, now they feel dirty. They feel like nobody's going to want to have any relations with them. So I not only deal with the disease, but we deal with all the psychological repercussions of it as well. There's other STIs that are not that all uncommon, and it just depends on where you are. But hepatitis is a virus, and that can cause liver cancer. And it's the most common cause for people having to have a liver transplant. One thing that I think that a lot of the students don't know is if you have STIs or STDs, as we used to say, you're more likely to get HIV compared to people that haven't had a sexually transmitted infection. Then syphilis, I haven't seen syphilis in a long time, but it's still around, and that's a very serious one if it's not treated. There's trichomoniasis. Some people don't have symptoms of that. We can treat that one. Then there's other ones you don't see as often, like chancroid, lymphogranulonum venereum. That one's a hard one to say. That's why we call it LVG, scabies, and many others. But the take-home message, what I really want to get across is there's no such thing as safe sex unless it's abstinence. The best thing you can do to help prevent spreading is the use of condoms. If you're having anal or vaginal intercourse, and condoms are not foolproof either. When they go through quality control, there can be tiny little holes in there that you don't know about. And that's why you see some people that have gotten pregnant, even though they were using condoms. But it's the best thing that we have to prevent infection. One thing that I do recommend to college students is to get tested fairly often if they go from one relationship to the next. We call it serial monogamy. They may date one person, have one partner for 3 to 6 months, and then another one for 3 to 6 months. You cannot tell a book by its cover. Doesn't matter how great looking that person is. It has nothing to do with cleanliness. And like I said, a lot of these don't have symptoms. So I think open communication about the sexual partners you've had and if you've been tested. And again, we can't test for everything on a man that we can on a woman. A man can carry HPV in their semen and not even know it. And I find it when I do a pap smear on the young woman and she has an abnormal pap smear and it's due to HPV. Does that make sense?
Yeah, that makes total sense. Well, thank you so much for sharing all that information. I think it's really, really critical. And I think you really busted a lot of myths that are out there. So I think that is so helpful. And so hopefully students will listen and share it with other students. And I think you hit the nail on the head in terms of communication with your partner about how many partners you've had, whether you've been tested, when you've been tested. All of that stuff is so critical, but it's like, I feel like we've lost a lot of our communication skills over time because of the cell phone, because we're dating by swiping right or left instead of having conversations like this to say, hey, can we talk about our dating history now? Like, I mean, I know that's a difficult conversation to have, but I think it's so, so critical. And maybe in today's day and age, we've just gotten away from those types of communications and we don't feel comfortable having those conversations. So man, oh man, so important. The other thing I wanted to talk to you about that is a big problem with college students is depression and loneliness. Talk about cell phone usage. I mean, even though the students feel like they're connecting more, the truth be told, they're actually very isolated and then they don't know how to communicate when it comes to sexual activity. So talk to us more about that cell phone usage.
Well, I do think the pandemic made that worse too. It was already bad, but it's made it even worse. And there's been a lot of studies just in the past few years about this, that having too much cell phone use actually increases the risk of suicidal ideation. And there was a Chinese study, and they found that the students that had dependence on their mobile phones, that was correlated with the suicidal ideation. And the risk was much higher in those people, and they had more depressive symptoms too. Suicide is the second most common cause of death in college age group. And we want to do everything possible to keep people interacting with each other rather than just looking at a screen. They're not really sure why the suicide ideation risk is higher with cell phone use. And by the way, in that study, those students were using the cell phone more than 5 hours a day. And but logically, if you think about it, we know that that blue light that is emitted from the cell phones interrupts sleep patterns and circadian rhythms. And it also decreases melatonin production. And of course, melatonin is the hormone that helps us with sleep. So if you don't sleep well, you don't feel as good the next day. You don't do as well on test. And you can feel more just sad and blue. It's kind of like if you don't exercise, you can feel fatigued. Well, if you're not sleeping well at night, you can feel fatigued and sad and blue. So I think that's a lot of the correlation, even though that's not proven. So, one thing that we saw in our practice is with college students, if I would try to call them to give them some lab results or to talk to them about something, I'd never get a call back. But if I would text, they would text right away. And that is a very strong trend. I saw that across the board. And you can't communicate that way because people can totally misinterpret what you're saying if you text something versus if you can see their eyes. And I think that that's another thing is people can misconstrue what somebody says on a text or with social media that they would take totally different if they were talking to them face to face. So I tell the female students, you make that guy call you on the phone and ask you for that time. Don't just text, but that's a recommendation. I would like to see more interaction. And I think it just make everybody feel better. They would see that they feel better, more upbeat if they're doing that.
I agree with you completely. I had no idea about the connection between some of the cell phone usage with suicidal ideation. Had no idea. So I learned something new today. That's really kind of riveting for me. And you're absolutely right in terms of communication. I mean, I'm working with college students all across the country that are booking me to come and speak on their college campuses. If I want to get a response, I mean, sending them an email or leaving them a voicemail message, forget it. They're never going to get back to me, ever. Ever. You have to text them. I mean, that's the only thing that they'll respond to. But you're right. I mean, all the time they'll misconstrue something that I say because they can't tell like the tone of voice. Like there are things that you lose through the text. And I know with my own Gen Z children, I mean, my daughter, like she will not pick up the phone and speak to like a stranger at like a restaurant to order something. It's like, no, here, Dad, you call and you call the restaurant. And I'm like,
I can relate to that remark.
I mean, you have to communicate with other people. It's the only way this is going to work. But like, she refuses to do it. But she's also brilliant. Okay, so there's that part too. She's way smarter than I ever was. But in terms of the social aspect, it's just not fully developed, or she's just not interested in having those conversations.
I don't know how we can change that. All I can do is just keep encouraging people to have those one-on-one, and also they have to do that when they go for an interview. Absolutely. You have to be able to talk to the employer, and if you're not used to interacting with people one-on-one, it's very difficult.
100%. That's why I keep pushing public speaking on college campuses. There's a course for that. Go and take that skill. Even if you're not in sales, just like you said, you have to sell yourself in an interview. If you don't know how to communicate, you're not going to get your dream job. Okay. Take that public speaking course and get through that. I also want to talk about alcohol because, the saying is, what you may not know about alcohol could sober you up. What are the facts on alcohol that our college students need to hear from you today?
Well, I'm sure they've heard over and over about watching their alcohol intake because of DUIs. I think that has gotten across, but there's other problems with excessive use of alcohol that they may not know about. And I see this in clinical practice. One is over drinking can dehydrate you. And I've seen students end up in the hospital because they're dehydrated from drinking too much, and it affects some of their electrolytes, magnesium, different things like that. Also, if you drink too much, you're going to reduce inhibition. So you're more likely to be involved with risky sexual behaviors or with gambling or getting behind the wheel, those type of things. But there's other medical problems that they may not realize are caused by excessive alcohol use. And I'm not talking about being a true alcoholic. I'm talking about just using too much alcohol. Young people can develop pancreatitis. That's an inflammation of the pancreas. It's very uncomfortable. A lot of times we have to hospitalize people for that. It causes a sleep disturbance too. You can develop gout, which is a very painful arthritis type condition. You can develop atrial fibrillation. That is an irregular heart rhythm that can lead to stroke. Now, most people think, oh, that just happens to old people, but no, it can happen to young people too. And I have seen that. And many times they don't even know they're in an irregular heart rhythm, which makes it even more scary. So it's not just about DUIs. There's a lot of other health issues. One of the things that I want them to know about is, I know this never happens on college campuses, but sometimes the guys can get a hold of Viagra or another medication for erectile dysfunction to enhance their activity. And if you drink too much alcohol and you take one of those medications and you're dehydrated, there is an increased risk for stroke. And I have seen that happen as well. And so we always say don't share medicines with anybody else, but you know, these things, there's always some underlying risk. And so if you shouldn't be doing it, you shouldn't be doing it because there's a good reason for it.
That's great information, Dr. Hall. I haven't heard anybody really talking to college students about that. Mixing Viagra, let's say, with alcohol. So thank you for sharing that information, because I know that's helping somebody who's listening right now. And you're absolutely right. I do think we've made some good progress in terms of DUIs. As opposed to when you and I went to college. I think now with Uber and Lyft and all of these other options that are out there, I do think the work that MAD has done to decrease driving while intoxicated, I think that has worked, which is good. But you're absolutely right. There's still a ton of alcohol abuse happening on college campuses. I try to teach, I don't teach abstinence, because to me, I just think it's a little naive for me to preach that on college campuses. I know they're going to drink alcohol. I try to show them how to do that responsibly. And so if your body is eliminating half an ounce of pure alcohol per hour, actually 3/4 of an ounce of alcohol each hour, and each alcoholic drink has half an ounce of alcohol in it, pure alcohol, then we know we can safely, responsibly drink by consuming, let's say, one beverage an hour, because your body is eliminating that 3/4 of an ounce every single hour. But if you also, to your point about dehydration, if we're alternating alcoholic drinks with, let's say, a bottle of water, then I think we get into a much safer situation. And by the way, you're going to feel so much better the next day, because you're not going to be hungover and dehydrated. So anyway, long story short, I think there are ways that we can do it and reduce some of those risks that you're talking about. Now, yeah. Now, your book, it's called The Other Side of Illness, Unexpected Blessings. That's going to be out in the fall of 2023. This is a compilation of stories about individuals who have gone through health adversity, and then some of the remarkable things that have occurred as a result. So why did you decide to ultimately sell your practice to a colleague and then start writing this book?
So last fall, I was diagnosed with breast cancer. And for the past 6 years, my husband has been living with stage 4 non-Hodgkin's lymphoma, and he's 14 years older than I am. So with the stress of that and running a business and being a caregiver, and then my diagnosis, we decided that it's time to stop and smell the roses. Now, I still have my passion and purpose, and that's preventive medicine. But through all the years of experience, I've come across so many different patients that have had all kinds of different health adversities, not just cancer. But because of that, remarkable things have happened. Maybe they started a foundation. Maybe they had an epiphany. Maybe they got reconnected with someone that they hadn't seen in years. Just very inspiring stories. And interestingly, I started this book about 25 years ago and set it aside because I just didn't have time to do it. And so once I decided that I was going to retire from full-time practice, I'm still working a little bit part-time. But once I decided to do that, I said, this is the time to write that book. And now I have even more stories to share. And my hopes is that it will be inspiring for people that are either going through the problem, some sort of health problem, or they're a caregiver for someone. All those hours that I was sitting there when my husband was having chemo, and he's been on 3 totally different regimens, I would have loved to have a book like that to pick up and just read an inspiring story, because it's very isolating when you have an illness like that. But one thing that I talk about in the book is not every illness has to be life-threatening to be life-altering. And even though I'm doing great from the breast cancer, it was life-altering. And we're not promised tomorrow. And I was on call 24/7 and running a business. And even though I love what I did, I want to have time to travel, do the book, and, just enjoy life.
Good for you. Good for you. Now, I do want to talk about cancer because it does impact, so many people, so many families. Everybody knows somebody. So why don't you feel people need to be afraid of cancer?
Well, one thing that I like to get across to college students is, even though they may not be in the age range where you see an increased risk, for instance, for breast cancer or some of the other things, if they start getting regular checkups and they learn preventative health now, they're less likely to have problems later, or if they do, they will catch it early. But there's a new test that has come out that we have started running. It's called the Galleri test. It's spelled Galleri instead of Y. And what's so cutting edge about this test is it can pick up a very small DNA signal for cancer before we would ever be able to find it with symptoms. And so I just want people to know about that. I don't get any kickback from the Galleri test, but I think it's fascinating. You have to have been cancer-free for a year before you can have that test done. But there's a lot of other screening tests that are available depending on your age. But one thing I think college students need to realize is that their skin is the largest organ in the body. And I've seen melanoma on young teenagers, and I've seen deaths from that too, which is, very, very sad. So if you're going into the doctor, you're getting regular physical exams, they can check your skin. They can talk about things that you may not even know are important. And as they get older, then if they're doing colonoscopies and the mammograms and I figure there'll be a lot more other tests like that down the road, but you've just got to get engaged and not just go by symptoms. If you just go by symptoms, a lot of things would be missed. For instance, my husband had no symptoms. All of his blood work was normal. And then one day he found a mass in his neck and had me check it. My mammogram was normal, but I saw a change in my breast, went back and had another mammogram. It was still normal, but it was picked up on the ultrasound. And so we have to be our own advocate for our healthcare, but we shouldn't be afraid of cancer, especially if we're doing our due diligence to take care of ourselves, because there's more and more tests coming out that can help us detect things early.
Yeah, that is really, I think, the biggest blessing of all is that there are so many tests out there that pick up these things way before you start seeing symptoms, which is so, so important. My father actually, he was picked up early on multiple myeloma, which is cancer of the blood.
Yes.
But they picked it up so, so early, which was really a blessing for him, because that enabled him to say, just like you, to say, you know what, I've done well in life. I'm going to quit my job and I'm going to travel the world and I'm going to reconnect with all my family members. And there was a shift. There was a real shift in terms of his priorities. And it went from, how much money can I put in the bank account to, like you said, stopping and smelling the roses and realizing what's really important here, right? So
that's why I tell people that illness can be a blessing in disguise.
Yeah.
It's too bad that sometimes we have to have an illness to make that shift, but sometimes that's what it takes for us to really appreciate every day and everything that we have. And I don't think you can ever talk to a cancer patient that won't tell you that every day is so special. It was before, but it's even more special now. And you really pay attention to things that bring you joy, and you spend more time on things that are really important to you, and you let other things roll off your back that used to bother you.
Yeah, great points. And, even to me, the son of somebody who is diagnosed with multiple myeloma, now I'm saying to my wife, we need to travel now. Like, yeah, we're healthy, like what a
Exactly.
great thing. Let's take advantage of it now, because just like you said, tomorrow isn't promised. I don't know what's going to happen to me tomorrow. I have no idea. So, let's just travel and enjoy things a little bit more.
I
So
would highly encourage that. You hear all these celebrities that are dying at a young age, and I've seen people wait until they retire and then they don't have their health.
right.
And so it doesn't matter how much wealth you have if you don't have your health to be able to go and do these wonderful trips. And so I would highly encourage you to do that.
Yeah, that's great advice. One more thing I wanted to talk to you about, because when we think of heart attacks, we typically think of men. That's typical. Talk to us about a different kind of heartbreak, which is actually heart attacks in women.
Well, it's really kind of scary because heart attacks are increasing in young women. When I was in medical school, we were taught that if you're premenopausal, before menopause, you're less likely to have heart attacks. But in fact, 20 years ago, it was 1 out of 5 women that may have a heart attack, and now it's 1 out of 3. A lot of people think that breast cancer is the #1 cause of death in women, but it's heart disease. And unfortunately, more women die from a heart attack. In fact, 3 times more likely to die of a heart attack than a man, due to unequal evaluations. Many times when a woman goes into emergency department, they think it's an anxiety attack, or if they don't have pain down their left arm, if it's down the right arm, they think that it may not be a heart attack. But a woman can present with chest pain, upper abdominal pain, pain in either arm. A man can too, as far as that goes, but nausea, dizziness, and many times having some anxiety as a precursor before they have the heart attack symptoms. And so we have to take that seriously. More women will have high blood pressure that's not been either diagnosed or adequately treated, diabetes, those kind of things. And sometimes women will just go in and get their annual GYN exam, but they won't go and get a full physical with all the other blood work. And most of the time, they don't even know they have heart disease. So I think it's important for us to realize this trend. And what's interesting, it stayed stable with men, and the rate of heart disease gone down in older people, but it's rising in the younger women. And when I talk about the younger women in the studies, they're looking at age 35 to 54, but that's not an age group past we felt were at big risk.
Yeah. Thanks for sharing that. That is absolutely life-saving. And yeah, it's interesting because even for men, I mean, I would go to the dentist every 6 months, but, to go for an annual physical was like sending a man to the moon. I just think that, like, as a male, I just feel invincible, and I'm as healthy as can be. I'm in great physical shape, so nothing can possibly be wrong with me. And so I went to the dentist one day, and the dentist decided that they were going to check my blood pressure at the dentist's office. And he does this for every one of his patients. Like,
That's
this is
good.
the norm and I said, good for you. And he tests me, and sure enough, my blood pressure is through the roof. And I had to be put on medication because my blood pressure was like way too high. But I never would have caught it if not for him, the dentist, checking my blood pressure. So anyway, so thank goodness for him and his staff. They literally saved my life. But check that often and go to that annual physical, because you got to catch those things before it does damage. I mean, that, if that was left untreated, think about all the damage that could have been done to my kidneys and everything else. So anyway, so that's it for the soapbox for today.
Well,
Now,
I'm glad they did that. And there's even more that I could tell you about how your oral health affects your physical health, especially with heart disease. But that's a whole nother discussion.
that's a whole nother podcast. We're going to have to bring you back for that podcast episode number 2. Now, we do love good food here at the Fraternity Foodie Podcast. That's my weakness, is really good food. And I'm going to be in Fort Worth on January 6th. I'm going to be speaking at a fraternity convention at a big hotel in Fort Worth. So I need to know, where should I head for good food?
Well, depends on what you like. There's a lot of good food around. We like Perry's Steakhouse. I don't eat a lot of steak, but they make great steak and everything else. And I know you're in Nashville, right?
I am. We have a Perry's in Nashville. Yeah.
I thought you had a Perry's there. You like good barbecue. Texas is known for barbecue. In Grapevine, which is one of the suburbs between Dallas and Fort Worth, there is a place called Meet You Anywhere, and that's got great barbecue. There's several of those around. So depending on what you like, lots of great restaurants in Dallas too. But Dallas-Fort Worth area is a big area.
It is. It's huge. It is absolutely huge.
And also, it depends on what your budget is.
Yeah, I don't seem to let the budget get in the way of good food. So if it's good, I'm willing to pay for it. I know Fort Worth has a ton of choices, so I'm definitely going to go and check out those two while I'm in town. So that is really, really good. Now, if our listeners, if they want to connect with you to eventually get your book, which is coming out in the fall of 2023, it's called The Other Side of Illness, Unexpected Blessings. Maybe they want to invite you to come to their campus as a speaker to talk about all of these issues. Where should they go to connect with you?
Well, the best way to do it is by my email, and that's Dr. Robin Hall, author at gmail.com. It's DrRobinHall, author at gmail.com. I have a new website that should be up within the next week or so. It's almost finished, and that will be drrobinhall.com or theothersideofillness.com. Either one of those will link to the same website.
Perfect. That is absolutely great. And Dr. Hall, thank you so much for sharing all of this information. I don't hear enough physicians talking to college students the way that you do, with the empathy and the care, and really just looking at, the holistic view of these college students. I mean, it just seems like doctors today, everybody's a specialist, and it's like they only deal with the right toe, and it's like the rest of it I don't touch. I don't know from nothing. And so you really need somebody to look at this from a holistic standpoint.
Exactly.
And really kind of try to figure out what's going on here. And it really seems like you've got that covered. So I just appreciate the work that you do. I'm a big fan of yours. I think you're just a phenomenal human. So all the best to you and to your husband with your health, with the upcoming book that's going to be coming out in the fall. And you know what? I mean, the best ending here is that you're stopping to smell the roses. That's it right there.
That's right. I know these were heavy conversations, but if it helped one person, then our job is done.
Absolutely. I'm very happy knowing that we are going to help at least one person, if not hundreds, with this interview. So thank you for the good work that you've done here today. I really appreciate your time.
Thank you so much. Have a happy holiday.
Yes, you too. And to our audience, if you like this interview here with Dr. Hall, make sure that you like it on social media and you share it with other college students on campus. And we hope to see you on another episode of the Fraternity Foodie Podcast. Thanks so much, and we will see you next time.